Hello everyone, my name is Pooja and I've done my master's in microbiology. And from the past 1.5 years, I've been associated with MyAussieTutor, an online assignment expert and deliver writing as well as online tutoring services. Today, we'll be discussing restraints in mental health settings. In this slide, we'll try to understand the learning outcomes, wherein we will first understand restraint and its benefits, what are the different types of restraints, and we'll try to discuss every type in detail, followed by the role of Mental Health Act and the role of healthcare professionals in ensuring a safe restraint process in mental health settings. Moving further, restraint can be defined as the ability to control or prevent actions or behaviors that are harmful or otherwise undesirable. Among mentally ill patients, which are more vulnerable and therefore reflect a lot of behavior changes. They most of the times do not understand the situation and they reflect a poor and bad mood behavior, which sometimes leads to self-harm or the harm to others. In mental health nursing, restraint is an approach of ensuring safety or maintaining necessary treatment. Restraints are typically forced on the patient population in case of emergency in order to manage their situation without their consent. So, restraint has two phases, wherein firstly it is trying to manage the patient and to protect the patient from being harmed, and at the same time it is also triggering various ethical challenges among the patient population. Restraint in mental health trust around 1847 injuries to staff in 2016 and 17. During restraints recorded by 22 trusts were about 26%, that is more than in 2013 and 14. Around 554 injuries to patients occurred in 2016 to 17, and only 22 this was the data recorded by 22 trusts, and around 13% more than in 2013-14. So the injuries related to the challenging behavior among the mentally ill patients is the reason that restraint is still existing in all the hospital settings and is managing the patients to an exponential stage. Further, we'll try to understand the different types of restraints. The physical one, wherein the physical help can be taken in order to isolate or restrict the patient movement, and the other one is mechanical, wherein the body parts will be limited. The third one is environmental. It is also considered as seclusion, and the fourth one is pharmacological or the chemical one, wherein restraint or isolation occurs on the basis of medications. So we'll try to understand each type of restraint in detail. Firstly, in this slide, we'll try to understand physical restraint. It is a direct physical contact where the intention is to prevent, restrict, or subdue movement of the body, because the body movement of that individual must be challenging and can trigger various harms to the patient as well as to the surrounding population as well. If we talk about hospital settings, then this mentally ill patient with challenging behavior is not only causing harm to himself but also to other patients as well. Therefore, physical restraint is important to manage the condition of the patient at that time. Positive and proactive care and Mental Health Act code of practice is also supporting physical restraint in most of the mental health settings. The physical restraint is usually used in the child and adolescent mental health services in order to manage the situation. But at the same time, the healthcare professionals are not choosing the option of debriefing and then restraining, which sometimes leads to various ethical challenges among the patient population. So restraint, physical restraint, by which physical forces can be applied in order to manage and control the patient in the hospital settings, is considered as physical restraint. Moving further, we'll try to understand mechanical restraint. It is basically the use of a device to prevent, restrict, or subdue movement of a person's body. Primary practice that is followed by most of the organizations in health and healthcare to manage the behavior control in emergency situations, such as in intensive care units. In case a person is excessively violent and reflects behavior challenges that can cause harm to the patient or to the others, is also a reason mechanical restraints have been applied. Handcuffs are usually the sources of mechanical restraint in most of the healthcare settings. Further, we'll try to understand the chemical restraint. It is usually a injection or any oral medication that has been recommended by the doctor will be provided to the patient in order to manage or calm down the patient at that point of time. In other cases, rapid tranquilization is also being used to calm the agitated patients. The code of practice says it may include oral medications or injections. However, the NICE guideline says it refers to an injection given if oral medication is not possible or appropriate and urgent sedation. It is an attempt to give medication intravenously, intramuscularly, and should avoid giving it orally because the oral medication always takes more time to produce its effect, and therefore IV or intramuscular injection are usually provided to the patient in order to manage their situation so that the agitation can be dissolved and the overall safety and the well-being of the patient can be improved. The next one is seclusion. Seclusion is a practice in most hospitals for isolating the patient in an isolated room. It is used only to treat aggressive or self-destructive behavior that jeopardize the patient's staff members or other direct personal safety. When less stringent interventions have indeed been found to be ineffective, at that point of time, seclusion came into the picture. The other factors that are affecting seclusion are levels of mental illness, lack of family support, type of setting, health illiteracy that contribute towards patient perspective in a mental health emergency ward. It is usually provided without debriefing the situation or the intervention to the patient, which can lead to various ethical dissolutions. It at the same time can dissolve the patient autonomy, wherein the treatment procedure will not be explained to the patient before providing them. Therefore, the autonomy and the beneficence bioethics will be dissolved at that point of time. But at the same time, it is required to protect the patient as well as the other members in that area. The nursing professionals usually enter into It can lead to various, therefore, ethical dilemmas among the nursing professionals, but they must need to show their skills and competence and problem-solving abilities along with critical decision-making capabilities so that effective restraints can be applied to manage the patient at that time. Mental Health Act Code of Practice is also supporting the different types of restraints and its implementation to manage the patient. It is a safe and therapeutic response to disturbed behaviors. The staff should work and know how different interventions should be used if necessary. The Mental Health Care Act Code of Practice also guides the healthcare professionals that they need to engage verbal communication as well as they need to ensure their presence in the isolated room or in case the patient has been restrained so that the patient won't feel he's alone and the psychological health burden can be lowered. They must also increase patient health experience by providing effective communication in terms of both verbal, non-verbal, and active listening. Healthcare professionals play also a very significant role in order to ensure that the restraint has been provided effectively and the patient management was done appropriately. They need to focus on their scope of practice and deliver health interventions so that patient health can be managed. So to summarize, we can say that restraint is the ability to control or prevent actions or behaviors that are harmful or otherwise undesirable. Physical, mechanical, chemical, and seclusion are 4 major types of restraint. The role of Mental Health Act was well explained in this presentation. Also, the guidance for healthcare professionals in case of restraint was also explored. So this presentation will surely help the students to gain better understanding about restraint and what are different types of restraints that have been used in mental health care settings. Also, what is the role of healthcare professionals in ensuring safe restraints among different healthcare settings for patient safety and well-being. These are the references that we used to design this presentation. Thank you and have a nice day.